welcome to today's public training, which is titled NEMSIS Research Tools, EMS Data Cube, and Public-Release Research Dataset. Today is Tuesday, June 1st, 2021. And we have the super team of Atim, Effiong, and Ben Fisher, who are going to lead this training. They're going to cover how to access the NEMSIS data through both the EMS Data Cube and the Public-Release Research Dataset. With that, Atim, please take it away.
Great, thank you, Chris, for the introduction, and good morning or afternoon, everyone, wherever you are. So I'll be going over the data cube and how to use the cube to help you start developing research questions for EMS data. This can be a good opportunity to get a good understanding of the EMS data that's available, and then to kind of figure out what kind of questions that you might want to ask. From there, you may be able to complete your research in the cube, or you may be needing access to the research data set, which Ben will talk about. But let me go ahead and share my screen, and I'll just walk through a couple of different queries to help you get an idea of the type of information that's available in the cube. So to start, you'll go to the nemsis.org website. Then you'll go to View Reports, and then you'll select the EMS Data Cube. From here, you'll see some information about best browsers to use for the cube, as well as the login information for the public cube. And so this is available to anyone who wants to look at EMS data. We also have some additional tutorials available on this page, as well as some additional resources, such as a supplemental cube guide, which gives you a nice breakdown of all the elements that are available in the cube and what kind of responses you can expect with each of those elements. We also have some additional information here for the V2 cube, which is also within this this full public data set or public data cube. So to start, you will click on the Connect to EMS Data Cube. I've already logged in with the username and password, but this screen will pop up and it will actually look like this once you log in, so it'll be pretty bare. And so to get started, you'll click this design button at the top and then select OLAP report. From here, you'll want to connect to the cube. And here you'll have the option to use the version 2 data or the version 3 data, which is 2017 through present. And for our purposes today, we're going to make use of this version 3 data. So we'll select that one and then we'll click OK. From there, you'll see this field list appear, which includes the measures that are available and all of the elements that are available in the cube that you can use to slice and dice those measures. We also have a 2x2 table below where you'll see the items that you click will fall into these different categories, and we'll go over each of them during our queries today. But I thought it might be helpful to look at maybe one topic and then see all the different ways that you can pull data from the cube to look at different things. So the topic that I picked for us is to look at cardiac arrest and look at those cardiac arrest elements and see how things have changed or what information is available in there. So if someone was interested in doing research on cardiac arrest and they were trying to get a handle of what kind of information was available through EMS, this could be a great way to do that. So we're going to go through 3 queries looking at various aspects of cardiac arrest, and we'll just jump in. So the first one that we'll do is looking at the average total call time for by urbanicity based off of cardiac arrest. So to start, we'll look here at our measures. We'll click the plus next to average EMS times. And you'll see there are a host of times available that you can look at. We're going to look at the total call time in minutes, which is the time that the unit was notified by dispatch to when the unit was back in service. So they were notified, they went to the scene, maybe they had to transport someone, and then they've completed that call and they're ready to take another call. So for all of the activations that are available in the cube from 2017 to present, you can see that the average total call time is 63.5 minutes. But we want to look at that information specifically for cardiac arrest, whether cardiac arrest happened during the call. So we'll go to this cardiac arrest elements and we'll click this plus sign next to it. And then this will give you all of the different elements that are available for cardiac arrest. We're just going to be looking at whether cardiac arrest took place during or after, or before or after the call. So we'll click the checkbox next to cardiac arrest. And then we can click the plus next to all, and this will expand and show us all of the different options for that element. So you can see there are no, not applicable, yes, after EMS arrival, and yes, prior to EMS arrival. We want to look specifically at the instances where there was a yes for cardiac arrest. So what we can do is we can drag this cardiac arrest from the rows down to the filters, and it'll bring up this other menu. We'll click this checkbox to allow us to select more than one option. And then we'll hit this blue triangle to hit the drop down, and then the plus next to all. So now we can select just the yes after EMS arrival and the yes prior to EMS arrival. So now we can see that for all activations that are in the cube from 2017 to present, that the average call time for a cardiac arrest after EMS arrival was about 88 minutes, but prior, if the cardiac arrest took place before EMS arrived, then it was 64.6 minutes. But now we want to see kind of how does that look across different urbanicities. So we'll scroll down to the geographic region of incident and click the plus next to all. There are a handful of ways that you can look at some region and geographic information, but we're going to be looking specifically at urbanicity at the incident, so where the cardiac arrest took place. So we'll click the check next to geographic region of incident, urbanicity. And then this time we're going to drag it into the filters, and we'll do the multi-select again, so that we can select just the options where an urbanicity has been identified. So we'll do frontier, rural, suburban, and urban. So now you can see that by urbanicity, some of these call times really do vary. And another way that you can look at it is there is some graphing options in the cube. So what we'll do is we will move our urbanicity information from the rows to the columns. So we'll just drag it there. And then we'll use the chart option, and we'll select a bar chart and click OK. And so for here, this gives a nice visual of those times, and you can see that, I mean, we kind of were able to identify before we broke down into urbanicity that when cardiac arrest happened after EMS arrived, that the total call time took longer compared to when they arrived or when cardiac arrest happened prior to EMS arrival. But now you can see that breakdown as well by urbanicity, which kind of gives you some nice insight into that. And maybe it was something that you had already thought might be the case, but you can use the cube to kind of confirm some of those initial thoughts that you have. So that's our first query where you're able to learn how to use some of the filtering and also use some of the urbanicity information. In our next query about cardiac arrest, we're going to look at what cardiac arrest looks like by age range. So we'll go ahead and we'll click this new report icon at the top. And so that will clear out everything. We'll connect to the cube again. And then we will start our process again. So this time we're wanting to look at cardiac arrest information by age range. So instead of looking at the times, we're going to use the summary measures to get our count of events. And so for 2017 through present, this is the number of activations that are available in the cube. And so that is anytime EMS went on a run. So this doesn't necessarily equate to the number, actually does not equate to the number of patients seen, but the number of activations that took place. So we'll use this number instead of the average times number to look at cardiac arrest by age range. So then again, we'll go to our cardiac arrest elements. We'll click the box next to cardiac arrest, and then we'll drag the cardiac arrest from the rows to the filters so that we're selecting just the calls where cardiac arrest took place. So the plus next to all, and then yes after EMS arrival and yes prior to EMS arrival. So now we have that information, and then we can add some patient demographic information. So in this instance, we'll want to look at age ranges. So if we scroll down to the patient demographics and click the plus next to all, we'll see that there's options for age and gender. For our example today, we're going to make use of the patient age. So we'll click the box next to patient age. And then again, we're going to drag this into the filters. And then we'll do the multi-select and we'll look at multiple age ranges for adults. So it breaks down into pediatric, adult, and elderly. Since we'll just be looking at adults, we'll break these down further, and then we'll select on each of these age ranges. And then we'll do the same thing under the elderly category. And so now you can start to see a breakdown of the number of events per age range for cardiac arrest. We can also move the age range into the columns, and then we can do another chart. So we could look at this as a line chart, and that just kind of gives us a nice visual. So probably again to kind of confirm where we think that the age ranges that most cardiac arrest takes place. But this is a nice way to help you visualize some of the information that you're seeing. And again, these are just our count of events, so they're not number of patients. So that's, I think, it's something important to always remember. And then in our last query around cardiac arrest, we're going to take a look at just the changes in 911 call volume from 2017 through present. So this one will give us an opportunity to look at some dates, as well as to add an additional filter to look at a specific call type. So we'll start a new one again. We'll connect to the cube. We'll still use 2017 through present. And then we'll use our summary measures again to get those counts of events. We'll add in our cardiac arrest element again, and we'll filter to have only those instances where cardiac arrest took place. And then we will add in some information about our dates. So to find out to get to the date information, we'll use this date times unit notified by dispatch. And here you can see there's a lot of options for dates. So depending on how specific you may want to get, you could even look at some of this information by hour of the day. For our purposes today, we're going to look at the information by year. So we'll select this first one, year, week, day. And then we'll move it down into our filters again so that we just select the years that we want to look at. So we'll select each of them. And so now you can see the breakdown of cardiac arrest for the count of events by year. But we also wanted to see how does this look like for 911 calls. So from here, we can go to the EMS response and then click the box next to type of service requested. We'll drag it into the filters again, so we can just select the one type that we're interested in. Oh, going too fast. See if it will let us. Let's try that one. So let me move this one back. Okay, so now we're back and we have our type of service. We can select all and it will show us all of the options, but we did just want to look at 911. So let's see if we can get that one to show. All right, so it's up again. This time we're just looking for one of the options, so we don't need to do the multi-select. We can just go to the drop down, click the plus next to all, and then select the 911 response. And so now those numbers have gotten a little bit smaller because it's just for calls that involved a 911 call. So we have that information for us, and then we can also look at this as well in a chart. So we can drag our year over to columns, and then we can do a line chart again. And so here you can see, like the difference in the count of events across years. When you are wanting to do some comparisons across years, we generally recommend using rates because each year more agencies and states submit their data to NEMSIS. So these differences in numbers don't necessarily mean that there were more cardiac arrests, but that may mean that there were more agencies coming on. So their number of calls is contributing to that. So when you're wanting to compare different years, we generally recommend using rates to help you kind of get rid of some of the variance in the number of agencies and calls that take place each year. So that was my portion, kind of demonstrating to you the different ways that you can use, or the different elements that are available in the cube that you can use to start developing a research question or figuring out the NEMSIS data or the EMS data and what kind of information is available in there. Sometimes, depending on the research question, you may be able to completely answer it through the cube, but sometimes you may need to use the public data set. So I'll turn the time over to Ben, and he will give us the rundown on the public data set.
Yeah, thank you. So real quick, I'm going to share a lot of documents in a web browser, but please know that all of them are available on our website. So hopefully none of this is too overwhelming, but just know that we're going to look at a lot of documents kind of all at once. So the first one I just want to highlight is the Data Cube page has a document that has, and I believe Atim mentioned this, a supplemental guide to all of the information in the cube. So this is our data dictionary with plain language values. So instead of looking at a code list, you'll actually see what the value options are for a variable as you're selecting it. It also has links in the data dictionary. Let me see a better example. To the formal data dictionary that has the more technical information about a variable and its values, as well as the codes there. So what I'm going to talk about today is the research data set. So NEMSIS each year publishes a annual data set for the queries that are a little too complicated to answer in the web-based cube. One of the differences to be aware of, though, is the data cube is updated online roughly every week. So the most current information will be in the online data cube. But again, as you start to get into slightly more complicated queries, will either run slowly or you may need to switch to the public-release dataset to answer some of those questions. So to request the public-release dataset, it's also on our website. You just go to using EMS data and request research data, which will take you to this page, which also has links to all of the resources we're going to talk about today. But the big one is this request research data set form. It's an online form you fill out. It takes about 5 minutes to fill out. And those get routed to us. We typically approve them within about 24 to 48 hours. And then we try to get the data set out each week. This was a holiday weekend, so we're running a little bit behind. But we do try and turn them around pretty quickly. Some things to kind of be aware of, and I'll just talk broadly about some of the limitations with this data set, are kind of unique to EMS data. So if you haven't worked with EMS data before, there are a couple things to just sort of be aware of. So this is all based on EMS clinical data that's collected at the time of care. This is claims data. There's, it is collected by a EMS practitioner in the field as they're providing care. So you have to keep in mind that may happen in someone's living room or the back of an ambulance. And so some data fields tend to be a little more missing than other data fields. So things like insurance information tend to have a slightly higher missingness rate than other fields, just because if you're providing, patient care in the back of an ambulance right in the hospital, you may not ask for a patient's health insurance information when you need their medical history. There is a map on our main page of participating states. Currently, not all states participate, but we do think it is pretty generalizable in terms of which states do. You can see in the map which states are participating or are close to participating, including some territories. The thing to remember is our data use agreements don't allow us to identify any individual state, but we can provide masked data. So if you want to compare something between states or counties, we can do that in a way where it's anonymized and you want to be able to identify any state or county. But if you just need information from one state, we'll typically refer you to that state's data manager. NEMSIS is sort of an exercise in federalism. Each state has a data manager, and then that data from each state travels to NEMSIS. So if you need it within one state, because that would identify the state, we'll typically refer you there. Some other things to kind of be aware of with this data set. So the data does use ICD-10 codes, and anyone who has used ICD-10 codes knows they're primarily for billing. They weren't really intended for EMS data. And so you'll typically see, as we start getting into some of the values where ICD-10 codes are used, you'll see kind of a distribution where a handful of very broad codes are used, and then that sort of trails off into some of the less frequently used codes. So the reason I bring that up is if you have a very specific disease or injury code you're looking for, you may not actually be able to find that specific code. You would have to look at all arm injuries to find one very specific type of arm injury. Or if you're looking for one type of disease, you may have to look at all the very sort of broad classification for that disease. So that's kind of the only reason I bring that up. And then a couple other just small things to mention. At the very bottom of the request research data page, we have the counts for each year of research data that are available and how many states they came from, how many reporting agencies, the number of events, and the number of treated and transported events as well. And you'll notice in 2017, it dips a little bit. That was the year that NEMSIS switched from version 2 to version 3. And so there was a little bit of a transition phase as the data switched and states switched from version 2 to version 3. NEMSIS formally switched to releasing the research data in the version 3 format in 2017, while some states were still on version 2. So there's a little bit of a dip there that I just like to make people aware of. then the last thing is the data set this year in particular is very large. So if you're doing a very simple query, sometimes it can be faster to run it on our infrastructure using the OLAP cube that Atim just demonstrated, but it's about 114 to 135 gigabytes uncompressed, depending on the data format, and about 45 million rows. So the only reason I bring that up is, especially with the 2020 data, sometimes you'll need to have your organization set up a virtual machine with a lot of memory, depending on the type of analysis you're doing. There are a couple tables I'm not able to read in on my laptop. They're so big in the 2020 data set. So that being said, we're just going to run through a couple of the documents, including the kind of most important one, which is the user manual for the 2020 data set. So real quick, I'm going to highlight a couple of documents. When you actually get the thumb drive, you'll get it sent on an encrypted thumb drive. So you'll get instructions with a FedEx tracking number and a password by email that will explain how to extract the data. And then that comes with a couple PDF copies of documents that are also on our website to be aware of. So in addition to the formal data dictionary, we have this document, which is extended data definitions, which is anytime we're talking about a variable or a value where there might be ambiguity or something you're not familiar with, it will sort of explain what these values mean or what we would like for them to mean when the group of data managers met and kind of determined these are the values we would like available. So you can see here for whether or not what the disposition of the patient was. These are the options. This is what the values actually mean. edisposition.12 is a bad example, so I'm scrolling down. But when we say you were transported lights and sirens, here's what we mean when someone selects a value of lights and sirens transport. So that can be a very helpful document. And then the data dictionaries are all also on the website. And something to be aware of here is we just released the next version, version 3.5 of the NEMSIS standard. Those are on our website. So you'll want to scroll down because even though it's available, agencies and states aren't reporting 3.5 yet. So make sure you're still using the 3.4 data dictionary. And there's a lot of documents here, but the web-based data dictionary tends to be kind of the fastest way to look through the data dictionary. There are PDF documents as well, and then national elements only. So something I just want to highlight in the data dictionary is, there we go. When you're actually looking at the elements, so this is the web-based data dictionary, you'll see a legend at the top with some different colored, N, S, or D. And it's important to note that what actually comes from agencies and states to the national data set are only national data elements. So within this very large data set, it's like a giant wedding cake. Agencies collect the most information, states collect a subset of that, and then NEMSIS, we only get elements that are national data elements. So within our data dictionary, if you're looking to do a research study and you really need a variable, you'll want to make sure that it's available within the national data set by either looking to see does it have that N in the data dictionary, or in that website, does it have, there's a separate document that just contains the national elements. I'm going to sneeze, so I'm going to turn my That's a fun thing to have happen on a video call. All right, so let's go to the actual user manual for the 2020 Public-Release Research Dataset. So this is a very lengthy document. It's included on all of the USB drives that we send with the dataset, but it's also on our website. And it contains a couple things that are kind of useful. So if you're unfamiliar with the dataset, there's a brief history of what NEMSIS is, some things we ask for you to do as good stewards of the data, some comments about the data quality and some assumptions. So we know that some data is missing. We do not say it's a population-based data set. It is a convenient sample because it's a voluntary system to report to us, and how we sort of address those things. We also have a list of selected publications for the actual data set. So if you're looking to see how other researchers have used the data previously, you can go through, and I think NEMSIS has been cited something like 140 times. So there's a lot of literature that uses this, including research types that I was kind of unfamiliar with. So it's good to see that people are using our data in interesting ways. We really like that. So as you use the data, if you do submit it for publication and it does get published, we only ask that you submit a copy of the publication to us. That's not a requirement, and we're not asking for review, but we like to know it's being published. And we do offer that if you are going to submit it for publication, we are always happy to provide input. We're available for consultations as well as to review a manuscript, even if it's just the methods section, to make sure that anything you're doing with the NEMSIS data is consistent with the data set. We're always happy to review things like that. We try and be helpful and friendly. So again, this is some of the caveats I talked about briefly. So it's a little bit about the data size for this year. And then a couple comments. So for the first time this year, there was a data date format change. So if you're binding multiple year of data together, just something to be aware of is that in 2020, the 2020 mid-year data set, the way the date formats occur in our data warehouse change. And so there's a little bit of a formatting change from ISO 8601 to a different format. So just look for that. We also provide, and I'll go over this a little bit more when we get into the tables, we provide some computed elements, and we also provide the actual raw data behind it, so that hopefully that's a little bit more convenient for you as you're doing analysis. So we provide a calculated age in years. We also provide a raw age. The reason that's important is there can be multiple age units and they're non-exclusive. So you could have 1 year, 365 days, 52 weeks, 12 months, all kind of in there, which is, if you need to calculate an exact age, that is what you would want to use. But if you're just looking for to the nearest year, we provide year format so that you don't have to clean that yourself. Some notes about data size as well. There are about 4 tables that are very large. They are the vital sign table, the medications table, and then pub PCR events is kind of everything that would be relevant in an actual clinical PCR as someone was documenting it. And then computed elements can be kind of large. The reason for that is you have to think about at a certain time, many vital signs might be documented. So you may see blood pressure, heart rate, glucose, all documented. So it's this very wide table. And same for medication. So let me scroll down here. And please feel free to type questions in the chat. And Chris, if you don't mind helping me keep an eye on the chat, I'm happy to answer any questions. We kind of go through this. Like I said, so there's a lot in this document, and it is technical documentation. So it can be a little bit of a dry read, but for the most part, everything's in here. There are tables for where you can find a specific variable. So if you're looking for a specific variable, what table it's in, as well as where you might find reference tables. So this first appendix, Appendix A, are reference tables for ICD-10 codes and where you would find an ICD-10 code. So we use them for cause of injury, primary impression, other symptoms. Anywhere that there would be an ICD-10 code, you'll see it in these reference codes right here. And so that table is just a list of potential ICD-10 codes. You would then need to join onto one of the tables that has all 45 million rows of primary impression ICD-10 codes, and that would give you the plain language description of what's actually ICD-10 code. So that's those. And again, you can see each variable here as well, where they're listed in each table. So if you're looking for a specific variable, you can Control F and you'll find the variable and then what table it's in. This appendix is the limited use variable description. So these are variables that NEMSIS collects, but we are not able to provide without de-identification. So we can provide you them in a masked format. It's usually a random hash about 5 characters long that you would then join back onto the primary key, which is PCR key in the data set. And then you would be able to tell which state a record, that each record for this state belonged to the same state, but you would not know what state that actually belonged to. So if you're doing a research study where you really need one of these masked variables, we ask that you email us. We'll talk to you a little bit about your project and then come up with a way to provide you with those masked variables that you need. We also have to be a little bit cautious, especially if you're linking it to other data sets, that there's no way to reverse engineer a location state or county. So for example, if you're using economic data to join with your EMS data, we may need to reduce the precision of the EMS data. So if there was, let's say you're doing county level economic data and EMS calls, and you wanted very specific economic data, there may only be one county with a certain income. We would need to reduce the precision so that at least 4 counties have the same category of income levels, so that you couldn't say that was that one county in reverse engineering. But we're happy to have those discussions if that's something for your analysis. This next segment of the document is lengthy and again, pretty technical. So these are the business rules that the EMS data set uses when we ingest data to make sure that the data essentially makes sense. It's logic rules. So, did a medication administration occur before the call was created? There's a way to document that if it's given by a bystander, but essentially, is the data being entered by a human making sense? And so this is done as the data is ingested. And so this is an example of sort of all of those cleaning rules, but then we also provide a couple pages down an example of, we do a little bit of extra cleaning for the Public-Release Research Dataset, just to make sense. So as I mentioned, particularly with things like vital signs, as a automated device is repeatedly taking an automated blood pressure and automated pulse ox, it will just keep adding rows and potentially columns as well, making the vital signs table really big. So we'll truncate them at certain values. So this explains sort of how we might truncate them. Typically we'll allow 30 values for a vital sign and an event. And that's just because, at some point this data set becomes really unwieldy. And for the most part, looking at the data set, we've set truncated limits that we think would exclude real outliers and not truncate any sort of anything specific, but it is stuff to kind of be aware of. Also, we look for things like elapsed time. Was the response time more than a day? We figure if it says that it took you longer than a day to drive to the call, it's probably a data error, even in a rural area. Finally, we get to 2020 contributing states and territories. We provide a copy of the extended data definitions, or a link to it, of the extended data definitions where you can find those values. And then again, this is Appendix E, where we explain each of the values that we compute for you. So we subtract E times 03 from and E times 06. So we look for the difference, and then we calculate that as the EMS system response time. So that not only do we hopefully do some of the computation for you, but then also that's a standardized response time for everyone to use. And then these are ICD-10 reference tables, as well as a little bit of additional information about what is in each table and each variable. So let me come down here and just pick one for example. So the table labeled fact PCR vital will have these variables in the column on the left, and then we provide a brief description of them as well. So if you're looking to do an analysis where you would really like to know the ECG type, you could join the PCR key, which is the unique value for each EMS activation, to these. And then you'll notice that any of these that have one-to-many, so obviously there could be multiple vital signs per patient, the PCR key will repeat in the data set, but the PCR vital key will be unique for each set of vital signs. So this one repeating is the same EMS activation, and then this one would be unique for each set of vital signs within that. Something that's kind of unique to EMS data, and the reason I'm saying EMS activation for PCR key is this is not a patient level registry. If you're unfamiliar with EMS data or EMS in general, just know that you may have multiple responders for one patient. So you may see multiple patient care reports for one individual, say a first response BLS fire agency, and then an ALS transport agency, and maybe a third service ALS co-responder, they would all generate patient care reports for one patient. So you would see multiple PCRs for one patient. So very careful to use the term EMS activations and not EMS patients. So with that, that is all the variables within the individual tables. That was a lot of information to throw at everyone. And I just am going to kind of highlight, so that is the user's manual, as well as we have the data dictionary for each of the values in here. So when you actually open the raw data, this is the document you'll want to use. And you can go to any of those individual variables and get information about what you're seeing. So the thing to remember is, instead of coding a character string for falls that there was a 20-foot fall, you'll just see this numeric code. And so you'll need the data dictionary to translate those numeric codes into what the actual description is. And then the data dictionary has additional information about what you're actually looking at. So, we provide typically comments if there were any changes, and then what the business rules are for this field. And then you can also see some additional metadata about each one. So it's national, it's state. Here's what the version 2 element looked like if you want to try and use data prior to 2017 as well. We do ask people to collect and report it. There are no pertinent negatives. Like clinical pertinent negatives. We do allow not values. So this means we allow not recorded or not applicable. It is nillable, meaning you can leave it blank, and it can occur, it can be one PCR key to multiple of these injury indicators. So with that, I'm going to kind of pause. I know there was a lot, and then check the chat. Please feel free to ask questions. We're more than happy to answer anything about these. And I'll also make sure that our emails are put in the chat as well if you want to email questions.
Hello, Benjamin. Can you hear me?
Yeah.
How you doing? Stephen O'Brady.
How are you?
Good, thank you. So, in regards to opening up the file, for those that, like after you put the password in, is there additional software needed to read the material?
Yeah, so that's a good question. So we provide it in 3 formats right now. SAS and Stata are both proprietary formats that require software and a software license for those 2 programs. The pipe delimited ASCII data, you can read into kind of any statistical programming format, program that doesn't necessarily require a license, or even a database program. The data is in a format and with the relational tables, so it's split out among 42 relational tables. You'll need something. So you'll either have to read it into a database, like a SQL database, or some, so Stata, SAS, R, SPSS, Python, anything like that that can do kind of large data analysis. But this one will, for the most part, require some coding. Excel won't work. You can read in the pipe delimited format into Excel, but there are too many rows. So Excel will start truncating. It'll just read in, I think it's like the first, I can't remember, I think it's like 1.6 million rows, and there's about 44 million rows. So it'll just cut off the rest of that data.
Okay, great. Is that information left in the chat for me?
If you're having trouble reading in the data, send me an email and I'll set up a Zoom call with you and talk about some options.
All right, great. Thank you, Benjamin.
So Abhijay's question, yes. So for Python, depending on which library you're using, either the ASCII data, some of the ASCII data can be a little bit weird. So you have to make sure to be a little bit careful when you're reading it into Python or R to use the correct quote string. So you'll have an escape character and then a quote, and then make sure you set up your all the options when you ingest it kind of carefully. And then, but I know there is also a Python library that can read in the SAS it's SAS 7BDAT format. It's a binary SAS file that we'll read in Python. The only catch there is it can be a little bit slow to read in some of the larger files. So you may want to read in the vitals table or PCR pub events and like make a pot of coffee. Is there a statistical estimate for number of patients versus cases? No, we have a hard time we get this question a lot. We have a hard time answering it. It very much depends on geography, sort of what the response looks like. There are some things we do to kind of help us with the fact that an EMS activation may represent multiple PCRs per patient. So as Tim mentioned, we calculate rates. Some things we do are we can adjust the denominator to only include patient contact. So you look in patient disposition and there's a list that will say, patient contact with treated and transported, or patient treated and transported. So any of those dispositions that start with patient, we assume a patient was actually contacted. The other ones include things like special event standbys, cancellations, other agency assists. So we might exclude those because the EMS agency never interacted with the patient. So we'll calculate a rate and we'll limit the denominator a little bit to depending on your research question. And you can also do 911 calls. So you may only want to look at 911 calls where a patient was contacted and then calculate a rate using that denominator. And we feel like that will give you a pretty good estimate of the prevalence or incidence of something you're looking at using those as kind of a filtered denominator. Yes, I agree with Dave a little bit, depending on what your question is. It's easier to use the library. Yeah, if you're using open source software, I kind of recommend you keep some of the formatting when you read in the binary data formats, but we're also talking about some things we can potentially do to the ASCII data to make it a little bit more user. And then John asks, is there a SAS code that should be used to read in the SAS data file, or will a simple import work? I believe an import will work. And I think I'll have to double check, but I believe we provide an example of a format statement for one of the data sets. I will just highlight, let me share my screen again here real quick. There are a couple other things that are kind of use on the research data set. I'm sorry, in the technical resources page. So if you come over to technical resources under data dictionaries and XSD, so we do provide these enumerated lists as CSV files. So if you're looking for, it's going to be kind of ugly on my web browser, but you'll be able to see for a variable both the numeric code and the text string to define it. It can be, both easier and harder depending on what you're doing to filter these. So if you know you just need the values for eResponse 05, you can open this in whatever software you're working in, filter for eResponse 05, and then snag the code and text string out of that, and then join them back to the to this column, and then you pretty quickly get the text string as well. I've done that for some analyses. It's more work sometimes, less work sometimes. If it's a really simple query, I would definitely use the data cube because you just get the plain text, values. And then I think it's on the request research dataset page. There is a SAS code file. We do provide this just as an example of both how to ingest the data and then some of the format for the relational tables. And kind of as I said, if you begin working and have questions about a unique problem, or if you're seeing anything you're not entirely sure of, we are more than happy to do Zoom technical assistance right now. If you need additional help, or you need to join it with masked data or anything like that, typically we'll open a ticket with our team and our statisticians. I can't give you a great time estimate, but we usually try and turn them around pretty quickly. So if you're up against a grant deadline or a publication deadline, please let us know as soon as possible, because sometimes our workload can get pretty high. But we will always communicate with you what that timeline sort of looks like to try and provide that data back to you or to be able to provide technical assistance. Anything else? All right, Chris, I'll turn it back over to you.
Great, thanks, Ben. Yeah, we'll put out one more call here. Is there any questions for either of our presenters while we have our subject matter experts online? Now would be the time. But if there are no other questions, I would like to thank Atim and Ben for taking the time and going over all this great information. We do these almost every month, and so if you want to be made aware of when these programs are going on, please go to the NEMSIS website. In the upper right-hand corner, you'll see a button that says subscribe to the NEMSIS Google group. You give it an email address there, and then you will be notified every time that we have an announcement for training or for implementation calls or other useful information that we feel for our NEMSIS stakeholders. Also on that page in the upper right-hand corner, if you are on social media, you can like and subscribe to our Facebook, Twitter, LinkedIn, or YouTube account. The YouTube account is where you will find a recording of this and many other, excuse me, and many other trainings and implementation calls and other helpful information about NEMSIS. Once again, thanks to our presenters. Thank you to our participants for taking time and asking such wonderful questions. I hope everybody has a great rest of your week, and we'll talk to you soon.